Chapter 13, choosing and implementing interventions to facilitate change. Okay, so the big idea here, and this is where we get to the fun part, like we've done all the assessment stuff and the interviewing and we've made goals and now we get to do the intervention, the practice stuff. So again, the big idea, intervention should follow assessment, not your preference. That's really, really, really important. Okay. So we are ultimately putting an intervention in place because of the data we have collected from the client in the assessment phase of the helping process. We're not choosing an intervention because we like it or we're familiar with it. Okay. So that leads me to my first big talking point. Number one, we want to try not to fall in love with one intervention. So it's really easy to eventually gravitate towards the better known interventions. And some of these you've maybe heard from or heard about. CBT, DBT, solution focused. These are all really, really great interventions and they make a lot of sense for a lot of clients. But the client should not have to fit your favorite intervention. So when something doesn't seem to work or doesn't seem to fit for the client, we have to do our due diligence to look outside of what we're familiar with or what we're used to or only what we really know and explore other interventions that might work and be successful for the client. And if we cannot provide that intervention, then it's our job, per our code of ethics, to refer out to somebody who can. For example, we have a number of clinicians in our practice that do EMDR for trauma. I am not EMDR certified, and I don't really know that I want to be EMDR certified. There's a lot of different trainings that I want to do, I want to pursue. I just finished a really super cool certificate on reproductive health, reproductive mental health, which is super cool. So I'm seeing a lot of women postpartum, women with PMDD, perimenopause, menopause, like all of those issues are often referred to me. But I don't do EMDR. So when a client needs EMDR, that is an intervention that I'm just not familiar with. So I can refer to another clinician in the practice, or if they're full, I need to refer outside of the practice. So keep that in mind. There's a lot of different interventions. Um, there's also a lot of different interventions talked about in this chapter. By the way, I'm not going to cover them because I think they're very self-explanatory. But if you have specific questions about any of them, or you want further information, let me know, and I'm happy to hop back on and do a video addressing it. I think a lot of this makes more sense when you get to see it in practice and then you get to do it. All right, next, match the intervention to the problem, to the client, the evidence you've collected, culture, the client's strengths, and the goals, right? So we're taking all of these bits of information and we're creating an intervention to fit, or we're using an intervention to fit. And we may use more than one intervention, right? That's kind of the cool part about intervention. Sometimes we can pull from CBT, sometimes we're going to pull from solution focused work. So we're kind of meshing a lot of them together because that's what makes sense for the client. A great example, I have a client right now who is struggling with severe social anxiety. And so, one intervention that we're working on is grounding techniques and relaxation before this person plans to leave their house. So, what are the things that this person can practice to ground themselves and settle themselves down before they go to an event? All right, so that's one intervention that we're working on. It matches exactly what this client came to me for and what their goals are. They ultimately want to get to a place where they can leave the house and not panic, right? So, we need to work on deep breathing and grounding, among other things. Next, we want to explain the intervention to the client. So, clients should understand what you're doing as the social worker and why. So, simple example, when I teach deep breathing, which I try to teach to all of my clients, I always try to explain why we're doing it and how to properly do it. So, for example, oftentimes when people take a deep breath, it comes from the chest, but ultimately, those are really shallow breaths. And it doesn't settle us in the way that maybe we're hoping it will. So there is a technique called belly breathing where we put one hand on our belly and maybe one hand on our chest, and we're literally feeling the belly rise and fall with each breath. So it's less the chest and more of the belly. That's going to help our body take in more air, more oxygen. It's going to signal to the brain that you are safe, you are okay. It's going to help us settle better than taking shallow breaths from the chest. I often will ask a client to keep track of symptoms outside of a session, and I explain why. I want to keep track of how often maybe they're experiencing panic type symptoms or how often they're having intrusive thoughts. Today I had a client do a circle of control activity, and it was really good visual for this person to begin seeing that there are, a lot of things outside of their control, but there's also a lot in their control. That's another really helpful intervention. So explaining the why behind that helps clients to get on board and become more invested in the work we're doing in the intervention part. Next, we want to monitor effectiveness. So if something is not working, don't keep doing it simply because the manual, the textbook says we should. So it always goes back to evaluating the intervention. And I often will ask clients to do that when they return. So I'll give maybe some homework and then they come back. The intervention piece is extremely collaborative. So I'm regularly assessing and evaluating by asking clients if what we're doing is useful. I always ask this in a follow-up session. Is it working for you? Did that work? How did you feel? And I tell them that it's okay if it doesn't work. That just means that we got to try something else. But it's helpful for me to know what is working and what is not, because again, it helps me monitor the effectiveness of the intervention, and it makes the intervention more collaborative with the client. One thing to remember, good practice isn't what technique do I know, it is what approach best fits the client and the client's goals.